and the IV medication bag. To hang a secondary line, a primary line must be prepared and primed in advance. Perform hand hygiene. Using the chlorhexidine swab, thoroughly cleanse the first port on the primary infusion line. Allow 1 full minute to dry. Cleansing with chlorhexidine will reduce the risk of transmission of microorganisms into the IV line. Check the expiry date on the secondary infusion set package and the primary line. Open the package and remove the hanger. Use the hanger to lower the primary IV solution bag. Gravity allows whichever bag is placed higher to flow first. Therefore, if a secondary medication is to be infused, it must be hung higher in order for it to flow. Remove the tubing from the package and inspect it. Close the roller clamp. Remove the sterile cap from the end of the tubing, being careful not to contaminate the tip. Stabilize the port and using a push and twist motion, secure the end of the tubing to the port. To replace the air in the tubing with solution, the tubing must be flushed with the primary line solution. Hold the secondary line down below the level of the bag of IV solution. Ensure the drip chamber is right side up so it will fill with solution. Without removing the protective spike cover, slowly open the small roller clamp on the secondary line and follow the flow of solution down the tubing and into the drip chamber. When the solution is about halfway up the drip chamber, close the roller clamp completely. The tubing is now primed and ready to use. Hang the secondary medication bag in the higher position on the IV pole. This ensures that the medication will infuse first. Remove the protective cover from the insertion spike and hold the spike in your dominant hand. Remove the cover from the sterile port on the medication mini bag and stabilize with your non-dominant hand. Carefully insert the spike into the port and twist to ensure penetration of the internal membrane. The secondary medication is now ready to be infused. Perform hand hygiene. When preparing a secondary medication, remember the acronym CABS: clean, attach, backflush, and spike.